this chap, if you pop your head outside. He's the TSCAN rep. Again, these are mock-ups. Ideally, a patient like this, I would love to move them from 6 across to 1. Orthodontics would be ideal, then we'd look, but he insisted he doesn't want orthodontics, he wants veneers yesterday. So we did a mock-up and we look at the options. We use, and we'll go through this, we use a lot of video. Count 1 to 10 for me.
1, 2, 4, done.
And we'll go through that whole process. So again, using the 2D, merge it into the 3D software, ideal proportions, looking at existing gum heights, where there's minimal gum display. I think some, and it doesn't affect the aesthetics. I don't consider gingival correction. So we don't just do it for the sake of the ideal. If there's no way that they're showing it, there's no need to get the scalpel out or correct it, unless it's a standout. In this case, we use pretty much his existing gum line with minor corrections in the anterior, or this is suggested. So you can see the gingival difference in the heights of the 1-3 and the 2-3, but aesthetically this is not going to be an issue. His lip, where his lip sits. It was more so the proportion, the curvature, where it sits in the arch. So the software is extremely accurate in terms of the amount of buccal contour, where it sits, so not only for gingival correction, but also for final milling of the restoration. Again, we get the 3D model back as an STL, we check, we print, we mock up, very easy, still prefer the silica, and that's a straight out mock up. I mean, I use this slightly, an A1, A2, but you can see, in terms of the ideal proportions for this patient, you get an indicator. You always show the patient, and we'll go through this, the photos, where you don't give them a mirror for these mock-ups. You want to have a look at it in terms of the face, look at the lines, compare it to both photos. Yes?
Just ask a question.
Sure.
If you've got excess tooth where you actually want to remove that tooth,
yeah.
How do you plan?
So usually you see that in canines, canine tips, and we'll show you a little trick. Use blackout markers. So often, and I've got a case where I've got the canine hanging down, but I wanted to show the ideal canine. And once you do your mock-up, these are perfect for additive cases, but then you get some subtractive points and you do mark them out. And Angela will show a couple of these cases, where often the premolars are hanging or some of the canines. You just get a little marker. When you take the photo, you see how, that's why you never give them the mirror to have a look at it. You sort of mark out those and you see the proportion on the photo. The idea is that you want to show them the proportion, the facially driven design, before and after. But even just blacking out looks amazing on a photo. You don't see that. But yeah, and then you've got to make that. You've got to make that decision as well. If it's a seriously, subtractive case, you've got to weigh it up. Even if you did that, you got to think, am I going to do this case harm or good? Or you might have to, and you with your smile design experience, you're going to say, I can do a mock-up, I can show you ideally what I want, but we're not going to be able to really see until I have some sort of orthodontic movement first. And often, sometimes you can ruin a case if you find it's a really extremely, subtractive case. So you might say, we'll go through the process. This is what I want you ideally. Even show the outlines. Now, once I've got you, or even 60 or 70% into the orthodontics, if they decide to go, then you can do your, then it doesn't look so bad. But if you've got these areas, these canine tips and premolars, I'll show you a black outline. Black marker works beautifully with the photography. And you can see, the reason you don't want to show these with a mirror is because it is additive. You're adding acrylic on top, so there is a sense of bulkiness. But in a photo, it looks fine. This particular case,